Hi guys, how are you doing? Welcome to another episode, interesting episode that usually happens to a lot of people. Many questions about it. Buzzword for some people, part of mental health, a topic that a lot of people would like to know about. Depression. Depression. What is depression? It's a medical symptom that negatively affects you as a person. The way you feel, the way you think. Fortunately, it's treatable, but it causes feelings of sadness, loss of interest in activities. Most of them sleep all the time. They don't feel like doing anything. It's not in their power. You may say let them snap out of it. They are unable to. They may want to, but the fatigue is so much. All they do is sleep. Actually, it comes in many ways. Either you're sleeping too much or sleeping too little, but you pretty much lose interest in the things that you once enjoyed. That's in a nutshell, that's what depression is. It can lead to a variety of emotional, physical problems, can decrease your ability to function at work and at home. Sometimes you're just a zombie. You wake up late, sleep all the time, and that is what depression is. You have the postpartum depression. I'm not talking about postpartum depression. This is regular depression. Loss of interest in activities that you once enjoyed. That's the best way I could put it. The simplest way I could put it is you lose interest in the things that you once enjoyed. It's insidious. Some people may not know that that's what they're suffering from. It's common, and most importantly of all, it's treatable. So we'll break down. It's a long topic, but I'll break it down as simple as I know how to. Symptoms vary from person to person, but generally overboard they're similar. I will list the symptoms. Feeling sad or having a depressed mood is one of them. Loss of interest and pleasure in doing things that you once enjoyed. Changes in appetite. Some people eat more and some people eat less, but mostly eating more. Trouble sleeping or sleeping too much. Loss of energy or increased fatigue. Decrease in physical activity. You used to work out, you don't work out. All you do now is inability to sit still. You just want to relax, but you don't exercise anymore. Feeling of worthlessness or guilty. Difficulty thinking. Difficulty concentrating or making decisions. And worst case scenario, thoughts of death or suicide. I didn't realize how huge that was until I still started dealing with patients that go through depression. It is huge. It is out of their control. You want to say what is going on with them. You want to get into their brain and think what they're thinking, but it's a heavy disease. Heavy disease, nothing that you can imagine. Nothing that you could have imagined about. Before I started working with mental health patients, I understood depression, but on a surface level, not on a deeper level. But once I went into inpatient mental health, then I understood it at a broader level. Have I understood it 100%? Probably not. It's an ongoing process. It's an ongoing learning, open for learning anytime. But it is a heavy disease, heavier than I had thought it would be. It happens to a lot of us. It can get anybody. Symptoms last anywhere from 2 weeks to a lifetime, depending on the individual. They can be confused. Some people with thyroid problems may think they have depression, so it's good to check out. They do have a test that they do to see if you have depression. It's called a PHQ-9. That's the test they do to see if you have depression. So you can check that. But some people with vitamin deficiencies, thyroid problems, brain tumor, it can mimic the symptoms of depression. So it's important to rule those out before you actually say it is depression. It affects a lot of adults, 6.7% any given year, 1 in 6 people. will experience depression sometime in their life. Anybody can experience depression. There are those who are at a higher affinity for it, but anybody really can experience depression. It's different from sadness or grief or bereavement. In grief, painful feelings come in waves. There are days you're okay, and there are days you're down in the dumps and thinking why this happened, why you lost a loved one. You think of positive memories of the deceased. In depression, interest and pleasure is decreased most of the time. So you're not going through waves. Interest and pleasure is decreased most of the time. In grief, self-esteem is usually maintained. In major depression, feelings of worthlessness and loathing are common. In grief, thoughts of death may surface when thinking of fantasizing about, joining the deceased, the way people who have lost a loved one. That's a heavy topic too. I should talk about grief now that we've said that. But in major depression, thoughts are focused on ending their own life. The depressed patient thinks of ending their own life. It gets that bad for the people who have the severe depression. But in grief, it's just thoughts of, oh, I miss this person. I should have joined them if they did. Do you really do it? In grief, you don't. In depression, sometimes they do attempt to actually commit suicide, unfortunately so. Grief and depression can coexist for some people. After they lose their loved one, lose a job, or become a victim of physical assault, it can lead to depression. It can lead to major depression. When grief and depression occur together, grief is more severe and lasts longer than depression. Distinguishing between grief and depression is important, because if you've gone through grief, you need to know, is this the grief that's becoming so severe, or am I getting depressed? We have risk factors. There are many resources out there, but we have risk factors for depression. And some people, personality, people with low self-esteem or who are easily overwhelmed by stress can get easily depressed. People who are generally pessimistic, they don't see anything positive in life, can be more affected by stress and lead to depression. Environmental factors for some people, continuous exposure to violence, trauma, neglect, abuse, and poverty can make some people more vulnerable to depression than others. It's depending on your makeup. If you're somebody who sees the good side of life, it's a little hard to get in there. But if you're somebody who is always a pessimist or see the bad side of life, then it's easier to get into depression. Another thing is biochemistry, differences in certain chemicals in our brain that may contribute to symptoms of depression. Genetics is another one. Depression runs in some families, and you're more prone to get the depression if it is in your family. So genetics does play a part in depression. How is it treated? It is treatable. Mostly with medications. If you adhere to the medications, then you're likely to get out of it. There are medications that work for you, and usually you will try with your mental health provider, your therapist, or your primary care. There are a range of medications. So the ones that work for you with less side effects, and you're the one who will tell them how you feel. If the medicine works for you, you stick on it. If not, there are medications that you can try. Granted, all medications have side effects. The only medication that doesn't have a side effect is the medication you didn't take. But any medication you ingest, whether Tylenol, ibuprofen, they all have side effects. So the good thing about it is treatable. They do have depression that's severe, that they have to do something more than medicine, but the general depression is treatable for most people. A thorough depression checklist is done for you. You fill out a questionnaire, you talk with the provider, and then they can tell you. It comes in 3 parts: mild, moderate, and severe depression, depending on the percentage of points that you get. Medications do work. They only work if you take them. If you don't take them, then it's not treating the depression, and you may be in that slump wondering why you're not getting out of bed and why you're feeling so bad and all that. but they do work if you take them. They're called antidepressants. That's what they give you for depression. They produce some improvement within the first 2 to 3 weeks. The efficacy of the medication is usually at 4 weeks. So anywhere 2 to 4 weeks, you're going to start feeling better if you're on the medication. The psychiatrist, therapist, or your primary care can alter the dose of the medication to get you to a good level. If it doesn't work, they can always substitute the medication for another one. As I said, there are many medications, SSRIs, SNRIs. There are many groups of medications. But what happens in this case, the person you're working with, be it a therapist, psychologist, psychiatric doctor, or your regular primary care, they'll alter the dose or alter the medication to the one that is more efficacious for you. If the medications don't work, don't be scared to tell the doctor. Let the doctor know that the medication is not working so that they can alter it for you, either increase the dose, or if they increase the dose and it's not working, then give you a different kind of medication. Is this a common disease? Yes, it is common. Do people talk about it? Some people do. Some people don't like to talk about it, but it is a common disease that people have. There's also something called psychotherapy, which we call talk therapy, where you have a schedule. You schedule with a therapist and you talk through your problems. It works really well for mild depression, not severe depression, but people with mild, moderate, or severe can all have a psychotherapist that they talk to. It is used along medications, so you can do the medications and still see a therapist. So if you're lucky enough to have one that you sync with, because there's some therapists that you have that you're like, no, we didn't mesh. Get one that you mesh with. And then that way, if you're using the therapist and the medication, it works better for you. Another thing that they do is cognitive behavioral therapy. That has also been found to be effective for treating depression. It's a form of therapy that's focused on problem solving in the present. It helps a person recognize distorted or negative thinking with the goal of changing their thoughts and behaviors to respond to whatever challenges in a more positive manner. That's what cognitive behavioral therapy is. So depending on the severity of the depression, treatment can take a few weeks. It can take much longer than that. But in most cases, significant improvement is made with psychotherapy, at least 10 to 15 sessions. So you can't go for one session and say, oh, you've started feeling better and stuff like that. No. It takes a few sessions. The first 2 sessions are probably introductory sessions. You're getting to know your therapist. You're getting to know, do you like them? Are you guys meshed? Are you in sync? So once you get to know each other and then you start working on it. If you get a really good therapist, it works wonders for the ones who have those therapy sessions. They benefit from them. They look forward to having the sessions and they take their medications too. So medications and the therapy work well together. Another one that they do have is called electroconvulsive therapy, ECT therapy. This one is reserved for patients with severe major depression. They've used medications. They feel just a little improvement, not so much improvement. They haven't responded to other treatments. So they've been on treatment, but they haven't responded to it. So this is for those people. It's reserved for people with severe depression. What it is, ECT treatment, it involves electric stimulation of the brain while the patient is under anesthesia. As odd as it sounds, it works amazing for most patients who undergo it. So you're under anesthesia and you go through this brain stimulation. That's what electroconvulsive therapy is. Most psych hospitals do have it. Psychiatric offices that deal with a volume of patients do it too. You receive ECT 2 to 3 times a week. That's how intense it is, for a total of 6 to 12 treatments. So you have to give it your time and believe that it's going to work. It does work. Majority of it works. There's some people with such severe depression, but when they go for it, it really does work the trick for them and they start feeling better. It's usually managed by a team of trained people. You go into this room and they've done research and stuff. They've been doing it for a while. Those who usually are psychiatric, anesthesiologist, a nurse, or physician assistant will be in there and they'll do the treatment for you. It's been used for a while, actually. It's been used for more than 50 years now. And lots of improvement has been found with it. So that's another way. If you've taken medications, your doctor has changed the medications you're taking and it's not helping, ECT treatment is a way to go. You've tried psychotherapy, that's the talk therapy with a therapist, that's not working, then you can try ECT treatments. It works wonders. It works wonders for those who try it. Then you do have self-help and coping. You know, there are a number of things that people do that help reduce their symptoms of depression: exercise, positive thinking, positive feeling. For most people, that improves their mood, getting enough quality sleep on a regular basis, eating a healthy diet. Sometimes that's hard in a depressive mood. But if as possible as it is to you, as much as is possible to you, if you can do that. Avoiding alcohol is another one that helps improves, all this can improve you or reduce your depressive symptoms. It's a real disease, guys. It happens to a lot of us, so watch out for your friends. Check on your friends. The ones that you call strong, those are the ones you check on. Or if somebody just disappears from your life that you've been getting together, it's good to check on people and see how they're doing, not how are you doing. How are you really doing? Take the time to ask that question. That doesn't happen in a text. That's a phone call when you find out how somebody is really, really doing. Let's be our sisters' keepers. Let's be our sisters' keepers. Some of these diseases are tough. You can't handle them by yourself. You need a group of warriors. You need a group of sisters. And you need a strong knit family that can carry you through such episodes. In the case of depression, it doesn't go away in a month or two. So if you're helping somebody through it, just know it's going to take them a long time. It's going to take them a long time. So let's be our sisters' keepers. It is a disease. It is treatable. This first step is to seek help. If you think you're depressed, you're sleeping more, loss of interest in activities that you used to do, and you think this, talk your concerns over to your primary care. If you have a close primary care, talk to them and, find out. There's a test they'll do. They'll tell you, are you depressed? Are you not depressed? It's real, it's treatable, and you can seek help for it. Thank you, guys. Have a wonderful week, and we'll see you next time. Bye-bye.